if you agree to do something, be present. Don't just go and show up and don't speak and don't interact, but really ask questions. Think about what's being said and what's being discussed. I think being present is something that sometimes people miss. They think if they just say, oh, yeah, I'll be on this committee and they show up, that's enough. But it's really not if you're really going to get the most out of it and give the most to what's being given to you.
Welcome to the Secrets to Abundant Living podcast. Your guide on this journey is Amy Sylvis, ready to unlock the keys to a life of true abundance. We're diving into everything from financial freedom and optimal health to meaningful relationships, geographic freedom, and everything in between. It's about creating a life rich in experiences, purpose, and joy. Get ready for empowering conversations, expert insights, and real-life stories that inspire you to live abundantly. If you're ready for the secrets to an abundant life, hit that subscribe button now, and let's get started.
Welcome, everyone, to the Secrets to Abundant Living podcast. For those who don't know me, my name is Amy Sylvis, and I'm quite candidly a little nervous because I have a really special person joining us today. I'm not nervous because I'm not comfortable talking to her, but I want this to be a really, really great episode. Dr. Jennifer Taylor-Cousar is my personal cystic fibrosis doctor, and gosh, someone I admire both personally and professionally. You'll see as we go through her story how she lives out abundance in her life and why she's such a tremendous role model to me, many in the CF community, and why I think you all will just gain so much from this episode. Doctor, thank you so much for taking the time out of your busy day to join us.
Of course, I'm happy to be here. It'll be a really fun half an hour or so.
Yes, I love it. I love it. I love it. Well, gosh, for those, I feel like I'm not even sure of your entire story. I'd love to hear a bit more about, just what you're doing now, how you got into the CF space, and really want to just dig in so folks can get to know all the great things that you do a bit more.
Sure. So I am an adult and pediatric pulmonary trained physician. So right now I'm a professor of medicine and pediatrics at National Jewish Health in Denver, where I'm the co-director of the Adult CF program and director of the CF Therapeutics Development Center. And I'm also the director of clinical research services here at National Jewish, which means that essentially all of the clinical research, especially the FDA regulated research, I help sort of oversee what's going on with the research coordinators and all the different trials that are happening. It's a really fun space to be involved in. And I have a lot of hats for other things outside of National Jewish that maybe we'll get into a little bit later, a lot of them with the CF Foundation. For example, I'm a member of the board of trustees as the adult patient care representative for the CF Foundation, which is also like a really amazing position and a huge privilege to be in that spot. But in terms of what brought me into CF, the very long story starts out when I was probably 9 years old. And I decided I was going to become a pediatrician because I liked science and kids. At the school I was going to at the time, when I was in, I think it was either 7th or 8th grade, they asked us to follow somebody around who was somebody we wanted to be like when we grew up. And my mom happened to have a friend who was a neonatal intensive care NICU nurse. And so I followed her around for a couple of days and became really interested in lung disease because she was taking care of babies who were premature and had respiratory distress syndrome. So when I went to med school years later, I planned to be a neonatologist to take care of those sick babies. But then when I got there, I was like, well, this is really interesting and I like it, but it's not what I thought it was going to be. And in the meantime, I met people with CF during my intern year because you took care of kids and adults as a med peds person. And just really, it was lung disease and infectious disease, but really it was the people who were just amazing. And so I got very interested in CF and it made a lot of sense later on. I decided to do combined residency and then combined fellowship. So that's the long story of it. It was really, I started out young and then sort of evolved my interests over time.
Oh, that's incredible. I didn't realize that started, from such a young age for you. What was it like? I hate that we even have to bring this up, but as a woman, as a member of the BIPOC community, what was that journey like for you? Was it, I don't want to put words in your mouth, but I'm imagining it was a male, white dominated field back then. Thankfully, it doesn't seem to be that way anymore. But Can you add a little bit of color around, what that was like for you?
Yeah, I mean, again, like, there's probably a lot to that, but
Yeah.
I think that I knew from a young age, just from experiences as most of us have being Black people in this country, like, very racist experience, being called the N-word as a kid, and so you already realize when you're really young that it's gonna be hard, and then, I mean, there were things that happened as I was going through school where I should have gotten certain awards or things that didn't happen that felt really biased in their intent, and then when I got to college, I had this assigned dean who my very first semester, I was, in the Black dorm for the first time. I was around a lot of Black people who were really fun and, not necessarily pre-med. And so it was hard to keep focused all the time on what I was doing in terms of studying. And instead of saying, maybe you should get a tutor or maybe you should do this or that, the counselor said, well, you should just probably not be pre-med. Never mind that I'd wanted to do it since I was 9 years old. And I was like, okay, well, you're fired.
Right.
Somebody else who was going to support me. And so I found somebody else, a Black woman actually, who was an advisor, and she was really helpful. But I remember distinctly one of the things that she did was have someone come in and talk to us about their journey. And this man said, he wasn't even talking about, I don't think, thinking about women's issues, but just said, as a Black person, you're going to have to work twice as hard as the people around you to have any kind of success. And so I was like, okay, understood. I have to do that. I don't think I really, because my mom had a non-traditional job. She was somebody who worked for Mountain Bell, but she wasn't somebody who sat behind the desk the whole time. She was one of those people who was like climbing the telephone poles and installing wires and all that.
Right.
My dad would cook, and so there wouldn't be necessarily traditional roles. So I wasn't expecting the sexism that also exists in medicine and lots of fields. So I think both of those things have been very hard to overcome at times, but you just have to keep working harder and pulling up people behind you because people have done that for you. And
Right.
eventually you can get through it.
Wow. Thank God you didn't listen to that dean whose answer outrageously was just change, but you found people who had charted the course, ahead of you, who could understand, your lived experience and add, encouragement. Wow. Yeah, I hate to say it, but I'm sure that probably hasn't ended, here in 2025. You are very likely still fighting those battles. Maybe they don't look identical, but it's so exciting that you are in so many leadership roles because you're able to, as you mentioned, pulling up people behind you, but be a voice at the table as well, I would imagine.
Yes, and that's one of the things that I also did early on because I do, because where I went to med school, residency, and fellowship, and between our intern year and residency, so your very first year as being like you have your MD and you're learning to be a doctor, and when you're going to actually be leading teams, they made us take this 6-week leadership course. And that actually really showed me the importance of formal leadership training because lots of people think they're natural leaders, and maybe they are, but there is training that can help you be a better leader. And so because of that early experience, I've gone through my career and done formal leadership training the whole time. And I think that's really helped me when I get into these positions because, again, you want to get these seats at the table and then you want to be able to pull other people up and make sure everyone's voices are heard. And so I highly encourage people who are interested in leadership to actually have some formal training.
Wow. That's a really good nugget. I hadn't really thought about kind of that formality because you think, I think all of us have thought of maybe the informal training by watching others or leading by their example, but actually getting that structure, I could see how that could really help. For those who don't know a ton about cystic fibrosis, I mean, they likely have heard a bit through this podcast, but from my point of view as a patient, as a provider in this space, I'm not even sure that I fully appreciate what it is like to take care of people living with such a serious illness. This isn't just a 9 to 5 as a physician, check the box, emotionally very light, right? I mean, this has been, thankfully, you've seen the disease evolve a bit, but just to give some context about what it's like to dedicate your life. I mean, truly dedicate your life to helping people like me with this illness. How has that changed for you over the years? How have you kind of dealt with the heaviness of what you've seen?
Yeah, that's a great question. I mean, it has evolved tremendously, but I think part of what attracted me, in addition to the people with CF and the intellectual aspects of respiratory disease and infection, was the fact that the TDN, or the Therapeutic Development Network, actually was formed back in 1998. That was when I was finishing med school. So there was hope because people were actually doing specific trials at that time to help people feel better with CF. I remember when I was deciding to go into CF, and I had a friend who was going into pediatric hematology, and she was like, "Oh, you're going into CF? That's so depressing." And I was like, that seems like a very interesting perspective from somebody who's gonna be an oncologist, but, I mean, I could understand what she was saying because back then, like, we still had teenagers that were dying of CF, but what I saw was that we were doing trials that could help people feel better and live longer. So, and of course, it's changed tremendously. Like, there are still some places in the world where people are dying very young. Fortunately, not here in the US generally. And we now have these amazing drugs that I had the privilege to help develop that are helping a lot of people, like the overwhelming majority of people in the United States and some of the other high income countries. So that has been really amazing to see. And like one of the coolest things about being med peds right now is that in my adult CF clinic, I have people who have children and some of their kids who don't have CF or have asthma or CFTR related disorder are my patients in my peds clinic. And so when I went into med peds, I never in a million years would have imagined that that's one of the things I'd be doing. So it's very, very gratifying, but it's been hard at times because I did lose patients when I was in training. And even as my first attending job, there were people who I'd become very, very close to, not just because I took care of them, because you, of course, in the past saw people at least every 3 months, sometimes sooner if they were really sick. And then when you start to do things like the advisory boards and the community events, you get to know people outside of the clinic. And so you become friends with people. And so it's not just your patients that you're losing, but your friends. And so it can be very hard, but it's gotten a lot better. I cannot tell you the last time I went to a funeral. That used to be a really, really common occurrence. And now I'm like getting notifications about baby showers and weddings. And so it has changed a lot. I mean, so I think that, the reason you're able to experience the heaviness is because there's also delight in seeing people feel better and have their lives change dramatically in really good ways as you develop new therapies that make them, live longer. So
Yeah.
that's the part that keeps, I think, is all of us going.
Oh, what a delight. What I love that you brought up, doctor, that you were involved in Trikafta development. For those who don't know what Trikafta is, and that's just one thing that you're involved in, but it is, the miracle medication that for the vast majority of us, not all of us, in high income earning countries, as you said, have benefited from tremendously. I'll never forget our conversation. You have a lot of conversations with patients, so I don't expect you to remember this. But when you mentioned there were two different medications that kind of had similar efficacy, that the CF Foundation was deciding which one to bring forward. And I remember you telling me that you were, I think, what I get goosebumps, one of the lone voices that talked about how one of these medications might interact with, may not work as well with women's birth control options, and how that was a deciding factor on kind of which of these maybe equally yoked or equally as effective medications, and what that meant to me as a woman and countless other women. And I just shudder to think, had you not had a seat at the table, I wonder if that would have even been a consideration.
Yeah. And this is why I think it's so important for those of us who are given the opportunity to take those leadership roles, because if you don't have different perspectives, then you're going to miss major issues like that and or not look at them in a way that's reasonable for everybody who might be affected.
Yeah, yeah. Well, and you talk so much, especially at the latest North American CF conference, where you really talk about inclusion and health equity, because cystic fibrosis, which, some who went to med school, decades ago may have thought it was just a Northern European, illness, which could not be further from the truth. Thank goodness we know that that's no longer the case. And that impacts, diagnosis. And the earlier we diagnose people, the better treatment we can get. But even some of these medications like Trikafta tend to favor people of European descent, right? People that are not of European descent may not have CF mutations that work as well with the medication. So can you talk a bit about what it's like to be a pioneer in that area? I think it's so inspiring, and I want our listeners to hear how you've really used your voice to make sure that these voices are represented.
Yeah, another really great question. I think the thing that was really disconcerting for me as a trainee was that I was in North Carolina, where the population of people who are Black is relatively high, especially compared to where I grew up in Colorado.
Yeah.
But I kept reading the textbooks that it only occurred in people who are white. But I'm like, that here's this patient that's on the ward right now who's not white. And so this makes no sense. And back then, it's hard to have a voice when you're a trainee or even when you're a junior faculty. But as you get further along in your career, you realize that there are going to be points where you can speak up or you can choose not to. And I have just been somebody, I mean, the first walkout I did was in high school when we didn't have MLK Day off in Colorado. So I've been doing this for a long time. And so I just felt like I needed to be the voice for the people who didn't have a voice. And so especially when the CF Foundation started giving more opportunities for people to speak up and help change the narrative, I felt it was important in the seat that I'd been given to make sure that I was at the forefront of that. Because again, the whole reason we do newborn screening for CF in every state in Washington, D.C. is because the earlier you diagnose people, the earlier you can start treatments and the better their outcomes. But as you were alluding to, because the new way newborn screening is done in some states, it misses a lot of people of color. And so therefore people were not getting diagnosed. And then even if they were presenting with the classic signs and symptoms, as you interviewed Terry Wright earlier in your podcast, he the classic signs and symptoms and still wasn't diagnosed because people are like, oh, you're Black, you can't have this. And I had the same thing with a young man who was only 34 years old. And when I met him, his lung function was in the 30s because he was Southeast Asian and people hadn't bothered to test him for CF, even though he was infertile and had pseudomonas and bronchiectasis. So a lot of people have been misdiagnosed, late diagnosed, didn't get intervened upon early enough, and therefore suffered a lot because of it. And it also goes back, like you said, to the fact that because it was talked about as a European disease, people didn't look for mutations or variants that occurred in other people based on their ethnic ancestry. And so therefore, when these drugs were developed, they were only developed for the mutations that were known in Northern Europeans. So even if someone is diagnosed, they may not qualify for the drugs because their mutations weren't tested. And so one of the things that I really commend the CF Foundation for is in their lab, they have been specifically testing mutations in cells to see if they respond to Trikafta or the newer drug, Aliftrek, and then providing that information to the sponsor because they're the ones that have to change the label with the FDA. And so that has actually helped expand the label, but we still have a lot of work to do. And of course, we have a lot more work to do around the world where there are countries where people still aren't even being diagnosed and there isn't any infrastructure for them to be diagnosed. So lots of work to do still.
Yes. Our CF community is small but mighty. And I just love that on the last day of the North American CF conference, this conference where people come from all over the world, to learn, you got a standing ovation for your amazing talk that talked about, yes, countries that are wealthier have access to these life-changing medications, but other countries don't, or people of different ethnicities don't. I mean, I'm not doing justice to your talk, forgive me. But the point is, it seemed like it was very well received. And it seems like, I don't mean to put words in your mouth, that when you've had the opportunity to speak up and stand up, even though you're very busy, you have a lot going on, you've really taken that opportunity because you know what comes from it, not just and your immediate impact, but those of us like me that are watching and that say, oh my gosh, look at this example. I want to follow that too. I want to make sure that I take advantage of these opportunities, even if they're hard, because it's the right thing and it's going to have tremendous impact.
Yes. And I think, again, like that's just, probably instilled in me by my parents and by their parents. I mean, if people hadn't suffered and experienced things in the past, that I wouldn't be able to be where I am.
Right.
For example, I'm the first Black female tenured full professor at the University of Colorado and National Jewish in the history of either institution. But there were people who came before me and started breaking ground of at least being like a person who was of color in these institutions, whereas for a very long time, there weren't any at all. And so if those of us who are given the opportunity don't speak up and don't push the envelope, then it's never going to change. So I feel like it's my obligation based on what people did before me to do that for other people.
Incredible. Absolutely incredible. Doctor, what else do you do in your life to give you fulfillment? I mean, obviously you've done so much for the CF community and, beyond, but what does abundance look like to you in your life? Kind of back to the overall topic of the podcast.
Well, lots of things. I mean, I'm really lucky in that when I moved back to Denver, because I did all my training outside of Colorado. Well, I shouldn't say all. I did my master's when I came back here in clinical science, but my parents moved back, and my sister lives only 45 minutes from me here in Colorado. So I get to actually spend all my holidays with my family now, which when I was younger, trying to get all of my degrees and all my training, I didn't get to do as much. So that is amazing. So I'll see them all on Thursday, and we just went to Zoo Lights on Tuesday. So getting to do that stuff with my family is fantastic. I also have amazing friends who I do things with. So we traveled together to dog shows and on vacations. And I love, love, love to go diving. It is like the most peaceful, mindful activity you'll ever do because you just go underwater and you breathe and you look at pretty fish and pretty coral. And so that's another thing that I do that's really fun. And then kind of in medicine, but outside of medicine a little bit is I work with orangutans. So orangutans are actually native to Borneo, and it turns out, get a disease in their lungs and sinuses that looks very much like CF or non-CF bronchiectasis. So I got called back in 2011 to help with an animal here in Denver who had chronic pseudomonas and bronchiectasis and sinusitis, as it turns out. And so we treated him. And then now I've been able to go every year to Asia with the help of a really fantastic family who happens to somebody in the family has CF who donates money because they're very interested in wildlife conservation as well. And so I go every year to Asia to help do consults and teach the veterinarians how to take care of these orangutans with respiratory disease using medicines that we use in CF. So that is also amazing.
Incredible. I just love hearing, just from the perspective of a woman like you that's so high achieving, makes such a difference, to also understand that you're a full person. I mean, not that there's anything wrong with dedicating your life to your craft, but, I know we both like football. I love, that you travel, spend time with family, with the dogs. I just think that that's such a beautiful representation of what we can do, as women or high achieving people, or, whatever lens you'd like to look at it through. So I really appreciate you sharing that. Doctor, not everyone has kind of this clear idea of what brings abundance to them or what they're really passionate about. We have some listeners of the podcast that are in their late teens, early 20s, maybe mid 20s, that are really trying to find their path. This is a little bit of a question out of left field, but would you have any advice for folks that are really trying to find, where can they get joy, get abundance, also have impact, that may not, I guess, have that natural inclination from a young age?
I think that it's really important to keep an open mind because obviously I did have some idea of what I wanted to do, but I also was willing to change that as I started to like really listen to myself and figure out what made me passionate. And of course, I think, there are always going to be parts of a job or parts of, personal life that are going to be not the favorite thing you ever do.
Yeah.
But what you can try to do, especially as you move along, is do more of the things that you really, really like that make you want to get up every morning and do less of the things that are hard and boring. And I mean, there are always going to be those things. There are always those aspects to a job, but find those things, pay attention to what really, really excites you. And be willing to have an open mind and try new things. I think those are probably the two most important considerations.
That's brilliant. Trying new things, because yeah, you really are at that age able to explore. And sometimes it's backing into, but it's a process of elimination of, oh, that didn't work, or oh, that's not really great. And so take that off the table and just continue trying. Love that idea. That's
And yeah, I
tremendous.
think one thing else I would add is that you really should, if you agree to do something, be present. Don't just
Mm.
go and show up and don't speak and don't interact, but really ask questions. Think about what's being said and what's being discussed. I think being present is something that sometimes people miss. They think if they just say, "Oh yeah, I'll be on this committee," and they show up, that's enough. But it's really not if you're really going to get the most out of it and give the most to what's being given to you.
You're a tremendous example of that. I love it. What else would you like to do to bring abundance to your life? Do you have anything else on the horizon that maybe is on a bucket list or that you've always wanted to do?
Well, a couple of things that are still on my bucket list. I've never been to Alaska because I like to go diving on vacation. So that is still on my list because it's a beautiful place from all the pictures I've ever seen.
Yeah.
So we'll eventually do that. But in terms of work, one of the things that I mentioned, I love, love, love seeing patients in clinic, but I also love doing clinical research because with clinical research, you could affect multiple people, like thousands all at once with the new trial development. And so I think that there are opportunities here where I currently am at National Jewish, where we are doing phase one, those very early trials of gene therapy, for example, in people with CF, but we care for a lot of other rare diseases here at National Jewish. So what I'd like to do is help build the infrastructure so that more physicians and physician scientists can start doing those phase one trials in these other rare diseases, because I really think that we have the skills here. We just need to build the infrastructure to do it. So that's on my big list of long-term plans.
Oh, I love the way you think. I mean, it is so clear that you're not looking at just what's in front of you, but looking how to enable others, set up the infrastructure, lift others up so that your impact can be multiplied. I think that's something I've continuously see you do. And obviously, I think all of us should try to emulate that, because that just magnifies our impact and allows us to have that lasting legacy. Oh my gosh. Thank you so much for joining us here today, doctor. I'm so grateful personally, obviously, for how well you've cared for me over the years and for you sharing your story and your wisdom to encourage folks that are listening to the podcast.
Again, my pleasure to be here. Thank you for inviting me.
Yes. And for those who might want to reach out to you, what's the best way for them to get in touch?
Oh, I can definitely give you my email address. Like, no problem. I don't know if it's easier for me to send it to you or just to tell you out loud.
Yeah, we'll put it in the show notes. So I'll encourage everyone to look in the show notes. Definitely reach out. I encourage folks to reach out. We've just scratched the surface of doctor's story and wisdom. So thank you again, doctor. I look forward to seeing you in Denver in a couple months. Thanks, everyone. Bye for now.
Thank you for joining us on another episode of the Secrets to Abundant Living podcast. We hope you found inspiration and valuable insights that will empower you on your journey towards abundance. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review. Your feedback means the world to us, and it helps others discover the secrets to an abundant life too. Stay connected with us on LinkedIn, Amy Sylvis. Keep striving for your goals, nurturing your relationships, and embracing the adventure that is life. Until next time, we wish you an abundantly fulfilling day.